नमस्कार सभी साथियों को। एक कोविड के ऊपर बहुत बड़ी कॉन्फ्रेंस होने जा रही है एम्स के अंदर। चलिए अब हम आपको लेके चलते हैं उस कॉन्फ्रेंस रूम तक।
Joining us, Dr. Manjari, Dr. Ambuj, as well as some people from the forensic department. We are waiting for them. So meanwhile, we can start. They'll start with a brief presentation, and then you can ask your questions. Right? Thank you. So,
We have presentation also. We have some presentation.
no.
No, no.
You can talk.
No. So question is let them ask question, na.
Directly, sir. Would you like to brief?
No. We all are aware about the COVID. The first time originated in December 2019, and then within 2-3 months, almost covered entire world. So within 3 months, a very fast propagation of COVID, irrespective of all measures, including lockdown. Then this vaccination came, and vaccination in our country we started from the 16th of January 2020. We started on 16th. In many countries like US and other countries, other European countries, they started in the month of December 2020, and we started on 16th January 2021. So we started on January 21, 16 January. Various the platform you are using for the vaccine, we all are aware, like messenger RNA. First time in human being we are using messenger RNA technology as a vaccine. Then in our country, two main vaccine, Covishield and Covaxin. Covaxin is completely indigenous vaccine developed here by ICMR and Bharat Biotech. All the clinical trials done here in this country, phase 1, phase 2, phase 3, including preclinical trial. Then Covishield, another vaccine, majority of us, we received Covishield, developed by AstraZeneca and Oxford University, and clinical trial conducted in 3 countries, Brazil, UK and South Africa, and they published in the Lancet. So different vaccine efficacy, like for Covishield, vaccine efficacy was 62.1. This was the vaccine efficacy. If with the 2 doses, 4 weeks apart, then there were some study that if we were increasing this duration from 4 weeks to 8 weeks or 12 weeks, then there will be effectiveness will increase. So the increases even in our country increases. So this is the overall background. Currently, there are 37 vaccines already approved by various regulatory authority. Even WHO has approved around 12 vaccines. And majority of these vaccines are on different technology. If you see like Covaxin, it's an old technology, whole virion killed. Then Covishield, they are using a vector that is your adenovirus. In Covishield, they are using chimpanzee adenovirus and spike protein they are using. So the antibodies they are producing against the spike protein. The other vaccine, like in our country, was this Russian vaccine. What was the name? Sputnik. Almost the same principle. The difference was only like this adenovirus was human adenovirus. So different technology we are using. So this is the current situation of the vaccination. More than 13 billion doses have already been administered all over the world. There are countries like, if you see the US, they have just vaccinated, completed 4th dose. Anybody above 6 months of age, if you see the CDC recommendation, anybody above 6 months of age must get a vaccine before the 2024 winter season with the latest variant, that is the genuine variant. So already they have inoculated. This is the recommendation by CDC. If you see the WHO recommendation, WHO also recommending even today that everybody 6 months and above must get vaccine with the newer variant. So this is all about the vaccine. You can ask question. We are ready to answer. Thank you.
Sir, so the main question here, और हिंदी में भी आप बताइएगा, क्यों अभी भी वैक्सीन को लेकर
तो पहले वाला हिंदी की तो जरूरत नहीं थी ना।
क्यों बोल दीजिएगा थोड़ा इसमें ही। सर, वैक्सीन को लेकर अभी भी लोगों में ये भ्रम है कि कहीं ना कहीं उसका हार्ट अटैक से जो लिंक है वो बार बार दोहराया जा रहा है, ऐसा क्यों हो रहा है? और अब आप देख रहे हैं अभी कर्नाटक में हासन में जहां पर 22 लोगों की मौत हुई है, वहां के मुख्यमंत्री कह रहे हैं वैक्सीन की वजह से है, तो इसके पीछे क्या और कारण आपको लग सकते हैं, हो सकते हैं क्या ये वैक्सीन की वजह से हो रहा है?
क्या आप कुछ इस पे कार्डियक है तो हमारे यहाँ कार्डियोलॉजी के प्रोफेसर हैं तो आंसर देंगे, फिर मैं कुछ ऐड ऑन कर दूंगा उसमें.
So I would just like to say that this is a very important topic and it has been in news for quite some time. There are young people who are dying suddenly or who are having heart attack, etc. So then there's an always issue comes and what is the cause. So many of these things, they are known from the past, from medical knowledge known, that the sudden arrest which occurs in younger persons, they have often different causes as compared to sudden arrest which occur in the older persons. So in younger persons, there are two kind of diseases or disease group we should be aware of. One are the rhythm problems. Now, rhythm problem, the heart structurally is all right, but they have some rhythm problem. Microscopically, the cells have got problem in their channels, and that sometimes leads to irregular heartbeat, and that irregular heartbeat leads to cardiac arrest, and the person can suddenly die. So that is a very well-known thing. This includes like Brugada syndrome, QT, prolongation, other channelopathies. So those things are there. So then another important group where there is a structural heart disease in younger persons, and that is called hypertrophic cardiomyopathy. So there the muscle of the heart becomes thickened, and the person otherwise may be all right, but again the heart is prone to go into different rhythm problems, and a person can have sudden cardiac arrest. So this is in the kind of young athletes, etc., and that age group. This is a little commoner thing, and this is picked up after they suppose autopsy is done. Then this will be picked up because the heart muscle will be found to be thickened. So that is another cause. Then in the older persons, we are all aware that is the classical heart attack, where basically there are plaques in the coronary arteries, which are small arteries supplying blood to the heart muscle itself, and those plaques they rupture, and on the top of that rupture, thrombus forms, and that thrombus leads to sudden occlusion of the blood flow to the muscle, and then the person gets a classical heart attack, that he gets chest pain in the center of the chest, crushing pain, and then sweating, nausea, vomiting, giddiness, etc., and the person can die because of again rhythm problems. So although all these categories they lead to sudden cardiac arrest leading to death, and it's very dramatic, but the causes are different. So this is one important thing. Then comes the issue of the why it is being reported more now. It seems to be more. So it's not only the disease, but other factors may also be responsible. Like following COVID, at least clearly two important things came around very prominently. One was the focus on health. That had come. The focus on health was much less earlier on. The channels, etc., were more focused on entertainment, news, other things were there. But focus on health has definitely become increased after COVID. That is one thing. Second is that the use of the social media, especially WhatsApp group, that has become very increased during COVID, because in COVID we were not able to meet like this. We were all alone, and so the best was to join a WhatsApp group, and then we were in touch with everybody. So that kind of thing. So that leads to immediate spread of news. The news become very viral immediately. Suppose there is a sudden death somewhere, and then the news, not only just the printed news, but also videos. Now everyone, earlier people were not having even cameras, forget about video camera. Now everyone is having not only camera but also video camera, and things are being recorded, things are being put on WhatsApp social groups, and they get spread very quickly. So this may be another reason why the news is coming more, people are being aware of this thing. So that is another factor. Then is the final the aspect about the COVID vaccine. Now the COVID vaccine, whether it led to some rare side effect, see, it is not a common side effect. This has been studied, the vaccines were studied very well, and the follow-up was done. So soon after vaccination, there was no significant increase in any side effects. What we are talking about is that very small, let's say 0.001 increase, if it is there, then over the population it will show up. And then it can be. So that is extremely small, and that will be negligible in compared to the benefits which is caused by the vaccine. So that is one thing. Secondly, the complication here is that vast majority of population was vaccinated. So there is no comparative group. everyone was vaccinated.